Hi everyone, I'm Paige Abbott, and this is your recovery message for the week of November 13th, 2016. Last week I had talked about an introduction to codependency and some of the traits and characteristics of codependency, specifically as laid out on the coda.org website, which I find is a really helpful resource. Today, what I wanted to talk a bit more about is the distinction between codependency and addiction involving relationships. And as a practitioner, what I find the most helpful to do is compare codependency and addiction involving relationships to substance abuse versus substance dependence. So we can think of both of these issues being on the same spectrum. So they're not two separate conditions. They're on the same continuum, but one is sort of a less severe version, whereas the other is a more advanced or progressive version. So what I mean by that is codependency would be similar to substance abuse. So somebody who is having some issues in their relationships, but with some awareness, with some consequence to this, where they really start to see, wow, this is unmanageable for me, I'm not healthy, this relationship is not healthy, and maybe taking the step to get some more education, some more information, they're able to make those changes quite successfully and quite consistently in their life moving forward. So without having to reach sort of this dramatic rock bottom or finding themselves repeating these same patterns over and over again over time, someone who's on the codependent side of the spectrum is typically able to move forward and maybe even past some of those relationship issues that they have, much like someone who's abusing substances but who doesn't have addiction. Once people have progressed along that spectrum to cross the pickle line, that point where they can no longer go back to just being an abuser of substances or a codependent, but they have manifested addiction, then that's where people will find themselves in the realm of addiction involving relationships. So what's different about addiction involving relationships is that people may have that same awareness as the codependent. They can see their behaviors as being problematic. They can see the issues that are coming from their relationships, but even with awareness, even with counseling, even with lots of attempts at change, they may still find themselves vulnerable to falling into some of those behavioral patterns that they've exhibited in the past. And that's common with addiction. So when addiction is involved, it's harder to maintain sort of this consistent level of not relapsing, not falling back into those old patterns, because addiction does tend to flare up. It is progressive and it is chronic, so it's never going to completely disappear. So for people with addiction involving relationships, they tend to have a harder time finding healthy boundaries consistently in their relationships. The other important thing to keep in mind if you feel or believe or have been assessed to have addiction involving relationships, then the truth of the matter is that you also have addiction. So for people who have crossed that pickle line, it also means then that they are vulnerable to other substances or behaviors that their brain may be using in an unhealthy way. So for somebody with addiction involving relationships, holistic recovery and looking at all aspects of their life and behavior would be very important, because their brain may be primarily using relationships to get a dopamine hit and a dopamine reward, but it may also be using or be vulnerable to using drugs, alcohol, food, work, exercise, shopping, spending, sex, and the list goes on of behaviors as well. So for people with addiction involving relationships, there's more factors to look at, and hopefully if they can do that, then that opens up the pathway to huge prognosis of health and recovery moving forward. But it does mean that there's a lot more that you have to look at than just addiction specific to relationship. Hopefully that makes a little bit of sense. I know it can be a confusing topic for people, and it may be difficult, if not impossible, for you to assess for yourself where you are on that spectrum of relationship. Are you on more the codependency side, or has it progressed to the relationship addiction side? And that is where you may then need to get an assessment from a qualified healthcare provider who's very familiar with addiction to be able to give you that assessment on have you crossed the pickle line. You can keep reading more about codependency with Melody Beattie, with the Codependence Anonymous resources. While both of those use the language of codependency, I would actually say, based on my own evaluation of those materials, that really more what they're talking about is addiction involving relationships. So even Melody Beattie talks herself about her own journey in the 12-step program and readily acknowledges having addiction herself. So while she uses the language of codependency, really there what we're talking about in her writings is more specific to addiction involving relationships. That's all from my perspective. That wraps up part 2 of the Codependency and Addiction Involving Relationships weekly recovery message. I'll be back next week with a new and hopefully exciting topic for you to learn more about and consider in your recovery. Over the next week, I wish you the best in your ongoing recovery journey. That's all for me right now. I'll talk to you later. Bye-bye.